Welcome to Reflexive Movement Instructional Video 4. If you've not yet watched the first 3 videos, please do so at the website reflexivemovement.com. Before we move forward in the 4th video, I'd like you to look at some pictures of the human ribs, spine, sacrum, and pelvis. This will help familiarize you with some of the landmarks of which we'll speak. There's 3 spinal techniques we'll go over. And since we're talking about spine, I want you to be extra careful to not have pain or discomfort while doing these techniques. If a technique is uncomfortable for your body or your arms, skip it and try the next technique. I'll also be showing you how to modify some of the positioning of the techniques to decrease stress on your shoulders and other parts of your body. So there's 3 that we'll go over today. There's a mid-level, there's a lower level, and a lowest level. So the mid-level is actually the ribs sacroiliac technique that we went over in video 3. So same side hand under your ribs, your right hand under your right ribs. The opposite hand reaches to the opposite ilium, resting your arms. Next is what I call the tilting table. You'll interlock your thumbs, extend your hands along and down your spine. Your thumbs will come under your ribs, and you'll apply pressure, tilt, and lift. And the last one is the triangle. You'll form a triangle with your hands. You'll apply pressure with the triangle with your thumbs over your lumbosacral joint, your hands over your sacroiliacs, and your fingers pointing towards or touching your tailbone. You'll apply pressure, tilt the triangle, and you'll open and close the triangle to apply traction and compression. So first, same side, hand under the ribs, reaching across to the ilium. If you can't reach as far as I am, just bring your arms out more. Anywhere under your ribs, even on the side. And just close to your ilium, or just at least your hand on your lower back, giving some support. So apply pressure, traction, switch to the other side. If the movement stalls, apply more pressure or more traction. Second, the tilting table. Interlock your thumbs. Your hands will extend along your spine, going down to about your lumbosacral joint, maybe a little further, just as long as you're supporting your back. You'll apply pressure. You'll tilt your body with your hands. Don't move your body with your body. Move your body with your hands. And you'll lift. Adjust your hands if your hands slide up, just as long as your back is supported. Lastly is the triangle. Form a triangle, your thumbs over your lumbosacral joint. May seem a little more sensitive there, especially if you're a decent age. Search for that lumbosacral joint and support that lumbosacral joint in your sacroiliacs. Find that the movement with triangle is the smallest. There's a lot of forces at work down here, so you have to be very careful. And then you can alternate. And those are the 3 techniques. Each of them, in different ways, applies protection through support. And the protection helps disarm the protective reflexes that your body has set up. You have to have some level of dissociation that you would have learned in the first 3 videos. And then either pressure, traction, or compression helps activate reflexive movement. So practice those techniques. The next video, we'll shift gears and we'll be delving into rolling techniques. Look forward to seeing you.